Let's bring in family medicine physician and associate professor for family medicine at Rowan University, Dr. Jennifer Caudle. Dr. Caudle, welcome back. I'm going to move on beyond the president. He should have done this months ago, so he gets no pat on the back. This is the bare minimum. But we know in Louisiana that the governor there, John Bel Edwards, has now ordered the wearing of masks in public. Are we seeing a similar pattern to what happened with the stay-at-home orders, that it's reactive? After there's a spike, then these things go into effect. And what would be the impact if we start on the front end by requiring people to wear masks and now asking people to stay at home?
Absolutely. Well, yeah, this does seem to be reactive, right? We're seeing spikes in Texas, Arizona, Florida, and so many other states that didn't necessarily have these mandates before, didn't have stay-at-home orders, or were not necessarily rolling back their sort of activities. Now we are seeing this. By the way, this is a good thing. This is exactly what we should be seeing, but this should have been done before. As far as I'm concerned, we should have a national mask mandate. Everyone in this country should be wearing masks when we are out and about. We've been trying to flatten this curve. Flattening the curve is really about keeping cases low so that hospitals don't be overrun, that we have enough PPE, that we're able to take care of our hospitals. They're not on divert and diversion, as we are seeing in many of these states, that we don't see an increase in deaths, or that our physicians become exhausted, which is exactly what's happening right now. The idea is that, I worry that at the end of this, whenever that might be in the future, when we look back in time, we look back to February, March, April, even now, that we say, goodness, if only we had just all been wearing masks, if only we had all just been hunkering down for a little bit more, look how many more lives could have been saved. That is my big concern.
Yeah, and Doctor, one of the trends that we've been seeing over the last couple of weeks is that these cases are trending younger. Younger people are getting sick. In Louisiana, for example, they're seeing a spike in cases among under 30-year-olds. But what's interesting is that they're saying that about 95% of their new cases are community spread. What does that tell you about what is and is not working, about how we are reopening this country?
Sure. So community spread simply means that it's people out in the community that are giving it to one another. We have been seeing community spread. This has been going on for months. But the fact that we're seeing younger people with higher rates of coronavirus, a number of theories behind that include, perhaps younger people are the ones that are not adhering so much to social distancing, maybe being the ones who are going to parties or to bars, et cetera, things like that. Some of the good news with younger people getting COVID, if there is any good news to this at all, which there really isn't, but it is good that young people don't tend to become as sick. But we do know that they can get sick. I have young people with coronavirus that have gotten it, that have had shortness of breath and other symptoms that have lasted 4 weeks. So young people are not exempt from severe consequences. We also know that young people can give it to older people. And this is one of the reasons why we all have to be doing our part in this. We all have to be wearing masks, social distancing, et cetera. But yeah, it does seem that a number of young people are increasingly becoming infected with COVID-19.
Let's talk even younger now. We're talking about children returning to school potentially in the fall. New York Times obtained this internal 69-page CDC document on reopening schools. A lot of it we've seen before, but this is a portion for the talking point section that says, while many jurisdictions and districts mention symptom screening, very few include information as to the response of course of action they would take if student, faculty, staff are found to have symptoms, nor have they clearly identified which symptoms they will include in their screening. In addition, few plans include information regarding school closure in the event of positive tests in the school community. For children, what symptoms do you think that they should be looking for, and do we know enough about how this manifests in children to create that list?
That's an excellent question. With regards to returning to schools, there are so many questions here. And I do stand with the American Academy of Pediatrics in stating that it is important for kids to be in school, if possible, for their psychological, psychosocial, physical, and academic well-being. However, that has to be done safely and only in the right circumstances, in places where cases are low, et cetera. With regards to symptom screenings, you bring this point up, and I think it's an indicator of a larger issue here. The American Academy of Pediatrics, as well as the CDC, has put together excellent guidelines about things schools can do to reduce transmission and keep schools safe. However, there are many questions that still exist. And quite honestly, schools need funding. This idea of symptom screening, which is a great idea, but the question is who would do it? What symptoms would we screen for? And Victor, to your point, you asked about symptoms. Many children are asymptomatic. We do know, and research has told us that many kids don't necessarily get severe symptoms if they get coronavirus. They may be less likely to get it, perhaps less likely to transmit it based on some evidence. But your question points to the larger questions we all have. How are schools going to do this? They need funding. They need leadership. They need support. They need a lot of help to be able to pull this off, if at all. So in some ways, I think there are, in many cases, more questions than answers that we have right now.
That's exactly right. More questions than answers on this very, very tough issue. Dr. Jennifer Caudle, thank you for joining us this morning.
Thanks so much.
Thank you.